Infidelity Talk, every Saturday with EJ, bringing what is most often left unspoken to help you understand that there is a recovery guide for anyone serious about changing their circumstances resulting from infidelity in a relationship. Now, here's EJ.
Hello, everyone, and thanks for tuning in to Infidelity Talk with EJ today. I'm your host for this hour on 97 KNUU. What a beautiful Saturday afternoon, just a day before Mother's Day. I encourage all of you to celebrate, and for those expecting a new addition to your family, enjoy the peace and quiet while you can, because it's not going to last. Today I have a guest in the studio that I believe will be a bit of a surprise, so grab that cool drink and get comfortable. First, though, I'd like to take a moment to express my sadness, very, very sadness, about a true gentleman and the finest of entertainers. Our great city of Vegas continues to mourn the passing of Danny Gans, an icon here that will not only be missed, but cannot be replaced. To his wife, his children, his family and friends, his peers, and of course Steve Wynn, another longtime familiar icon in our great city of Las Vegas, my condolences and prayers are with all of you. I'm actually still in shock. You know, it's really hard to believe that he's no longer here for us. For reasons none of us know or really will ever understand, Danny Gans was taken far too soon. My guest in the studio today actually spends much of his time in his profession with individuals and families who have experienced loss in some way also. This individual understands just how infidelity and betrayal can shatter even the strongest relationships, ultimately affecting your marriage or in a long-term committed relationship. He spends his days listening and talking to you, working with you, and together you form strategies and care plans that are created, and you put them into action. He's here to answer those hard questions that you want answered. Each of us are here to help you today navigate through those trenches of infidelity that affairs create. Well, you've got a lot of questions. Do you hang in and head for the door? Will you survive as a couple, or do you just call it quits? This gentleman today, he understands different reasons why people have affairs and how infidelity can question a sane person's sanity as he hears the heartache and he sees each day the devastation that this topical issue creates for you and those close to you. Whether you're the cheating husband, the partner, the unfaithful wife, the betrayed wife, the other man or other woman, remember that single person with a married person, or the children, the real victims caught up in your parents' mess, he believes, as I do, that positive mental health can be restored to you and your family, even after infidelity threatens to take over. We've talked about this before. Divorce does not have to be the end result after infidelity is exposed and is no longer a secret. Dr. LaRusch is here for an hour. His name is Dr. LaRusch, and he's here through the hour as we discuss your options and have those hard questions answered that you want answered. Having been a psych nurse myself, we're here to debunk the myths of the stereotypic profile that has often been attached to this field of medicine. The doctor is a board-certified psychiatrist here in Las Vegas. He specializes in outpatient services and works with a variety of mental health issues for his patients. You might be saying, EJ, why in the world would I go see a psychiatrist? I can just hear you saying, thank you, but no thank you. I'm actually okay and I don't have deep-rooted mental health issues. Why would I choose a psychiatrist to see? I understand your hesitation, everyone, but keep an open mind, because at the conclusion of the program today, you're going to have figured out why I have asked Dr. LaRusch to be a guest. He's in private practice for the last 5 years after an extensive amount of education and degrees that would exhaust the stamina of anyone. No wonder I chose nursing instead of being a physician. Dr. LaRusch did his undergraduate work at the University of San Diego in California. Medical school was completed at the University of Irvine in California. I guess you liked California, Dr. LaRusch. And his internship in medicine came from the University of Colorado. A light for this man at the end of his long road to achieve his goal came right here from the University of Nevada School of Medicine in Las Vegas, and he served as a chief resident in the Department of Psychiatry. Welcome, Dr. LaRusch, and thanks for being here today to discuss why infidelity matters to you as a doctor. Let's actually begin with, why is it important in your practice?
Infidelity, first of all, thank you for having me, EJ. I appreciate that generous introduction. Infidelity is very important to doctors, especially psychiatrists, because people react to infidelity in different ways. Some turn to eating, gambling, and drugs and alcohol as a way to cope. Or they step up addictions that were in remission or addictions that were in semi-control to problematic or downright incapacitating levels.
I understand that.
Yeah, domestic violence rates tend to be higher in households with infidelity and strife. Murder and suicide are all too common. Infidelity can trigger other reckless and dangerous behaviors like abuse, both physical, sexual, and emotional.
Pay attention, listeners, to what he's saying. It can happen.
It can cause people to reckless drive or drive recklessly, child endangerment, spending sprees, sex sprees, to name a few.
My goodness. So many. I would like to know, Dr. LaRusch, how do you remain objective? You're a doctor. I don't know anything about your personal background, but how do you sort out your own beliefs as it relates to infidelity about this controversial issue and keep objective as you're dealing with someone who might come to see you? Does it interfere with your treatment plan for patients? And really, how do you not judge that cheating person?
It's part of the long, hard road of training. As you mentioned earlier, I've had lots of training.
Extensive.
19 years to be exact. Been studying and researching and doing training from ages 17 through 36 continuously each year. And during that time, you do a lot of patient care. You are supervised in your cases, and then you get to the point where you start teaching other residents. And years of practice is how you're able to be objective. Sometimes it's very hard, but it's part of being a professional.
Do you think having someone with infidelity is easier than having someone come in who's been involved in domestic violence?
Those are both very hard to deal with. Domestic violence is I should probably bring up that we're, as a psychiatrist and a physician, we're mandatory reporters. So if we see abuse going on, we have to report it legally. It's our obligation to report it. Infidelity, we don't have to, obviously, report that. But those are both very difficult issues that I come across all too commonly.
Many people are reluctant to seek any kind of therapy or help, whether it's a therapist or a counselor, a clinical psychologist, a possible psychiatrist, and I know most probably wouldn't have thought of coming to a psychiatrist for help. And when I first met you, I really was taken back